looking at the security implications of the current health crisis. Today, we're looking at the surveillance in the liberal state. The idea that we are using a variety of apps in countries, particularly in Asia, have used a variety of apps to isolate, to get information on infected people, and to tackle the pandemic. And the question is, can this actually square with a liberal state? And are these the kind of technologies that we can adopt in the West with profit and to our advantage without compromising on our principles? I'm joined today by Dr. Nicholas Wright, a neuroscientist and someone who has written extensively on artificial intelligence and the interface between artificial intelligence and the impact it has on the liberal state. By Dr. Elizabeth Braw, my colleague here from the Institute, who is a senior research fellow on modern deterrence, the whole concept of the new resilience and deterrence of the state as it is being challenged by current threats. And finally, last but not least, by Dr. Siddharth Kaushal from the Institute, who's a research fellow and looks a lot at the impact of technology on our current strategic thought. I should tell the audience around the world that you do have on your app, on your Zoom app, the Q&A facility. Please keep the questions coming in. I can't promise to take all of them, but I can promise to give you a fair hearing. We will hear, first of all, from our three panelists, and then we will move to the questions and answers. But please feel free at any moment to introduce yourself on the Q&A function and to tell us what your question is. We have quite a number of questions already. As you can imagine, this is a fairly sensitive topic. Nick, let me turn to you first. You recently published an article in Foreign Affairs, the Bible of the American strategic community, at least, asking precisely that question about how much is it feasible for liberal countries, for liberal democracies, to adopt some of the measures that seem to have worked very well in Asia in terms of limiting or at least handling the current pandemic. Try to summarize for us your argument.
With great pleasure, Jonathan, and thank you very much, Jonathan and Elizabeth and Sid, for inviting me today. So, as you said, I publish in America and I interact with American people a lot. I love PowerPoints, so I'm going to use a PowerPoint now, if that's okay. Right, so okay, so I think the first thing to say is cast your mind back 6 weeks, and in March 2020 almost everybody agreed that COVID-19 is changing the world. You have lockdowns in democracies like France or Italy, huge economic devastation, deaths by the thousand. And as with all such epidemics, you need public health control, and public health control relies on effective surveillance. If you want life, liberty, and the pursuit of happiness, you first have to have life, and surveillance helps ensure that life. Now I'll try and think back to February 2020, which seems like an age ago, when we could all have met in person somewhere in central London. In February 2020, a lot of people were very concerned about competition between great powers involving artificial intelligence and the digital technologies. Okay, you had the fourth industrial revolution, you had changes in a wide variety of different aspects of strategic balances and so on and so forth, economic balances. And in particular, China was building a digital authoritarian surveillance state. And it was competing with the US to shape global standards and infrastructure. Think about things like facial recognition standards, competitions at the UN, or debates about Huawei. Now, all of that is still true, okay? And so what I want to talk about today is how these two critical factors are going to interact. Okay, if you want to understand a lot of the next few years of world history, it's about the interaction of these two huge forces, and that's what I want to talk about today. And what I would argue is that what we need to do now and after COVID in the West is develop a form of democratic surveillance. So democratic surveillance that harnesses the huge upsides of surveillance. We need surveillance for public health without sacrificing democratic values. Okay, and we need to demonstrate that successfully to the world. So why is surveillance so central? Surveillance is so central because this is a public health emergency, okay? And surveillance is absolutely central to public health. So I'm going to take you to Soho now, about a mile from Rusey, about a mile from my medical school in London, to the first and probably most famous case in public health, right? This is the case of, so you see Jon Snow, top right, famous for those of you who watch Game of Thrones. You have Jon Snow, but for me, as someone who's interested in public health, you have the slightly geekier looking Jon Snow down there, who was a famous doctor. And what Jon Snow did was, this is in the 1850s, and cholera, waves of cholera had been killing thousands of people in Britain. And it really, this is he was the first person to really do modern public health in many ways. And what he did is, there was an outbreak of cholera in 1854 in Soho. And he patrolled carefully the streets around Soho, okay, and he identified where all the cases were and where the cases need to be clustered. And he found, by collecting that data, that the cluster was around a pump, a water pump, so a pump just for pumping water, in Broad Street, the Broad Street pump. So within a few days, hundreds of people had died, rich and poor alike. It was all a disaster. So he went and took a sample from this pump, and he found what he described as white flocculent particles when he looked under a microscope. He went to the local authorities within about 8 to 10 days of the thing starting and said, look, I think this pump is the problem. The local authority agreed to remove the handle of the pump, the physical handle, so people couldn't pump the water out. Right, and cholera cases started declining markedly once this pump handle had been removed. The key point here is, and this is the prototypical public health case, right? This is the origin of public health in many ways. And what's critical is that everything that we're talking about now in 2020 really was involved in this case. It's about surveillance. He did extensive contact tracing as well, and it was about detective work. Right, this is absolutely central to public health. It was central in 1854, and every new generation up until now, all we've done is we've institutionalized public health, and what we have done is we have applied new technologies. So obviously, as new technologies come on stream, here you see this public health physician from the 1950s. You see him there with this fancy looking telephone and so on. So it's actually my grandfather. So I'm Dr. Nicholas David Wright. He was Dr. Sidney Lawrence Wright, who's a public health physician in South London. And he was the person who looked after Croydon Airport in the 1950s, which was the main airport before Heathrow for London, the main international airport. And he, for example, used to, when someone arrived and there was the possibility they might have had smallpox, for example, he would go along and he would scrape the lesions, do contact tracing, do all that kind of stuff, send the lesions off for virology. And in terms of debates on modern debates about PPE in 2020, he used to keep an old suit in his office that could be burned if any of the smallpox virology came back positive, right? Fundamentally, he was just doing an institutionalized version of what Jon Snow is doing, and that's exactly what we are doing in 2020. Surveillance is critical, and obviously now surveillance involves computational modeling, digital technologies, AI, and so on. This is just the latest iteration of what we've been doing for the last 170 odd years. So, and it's not just public health, there are huge upsides of surveillance, right? Surveillance was central to the last 2 centuries of economic and political progress in countries like Britain and America and Sweden. And in those countries, it's really important to say that we greatly deepened our surveillance capabilities of government, of academia, and of the private sector. And in all of it, for example, in Britain, the US, or Sweden, whilst continually massively deepening our surveillance capabilities, we also deepened our democracy, right? So it is absolutely not an oxymoron to talk about democratic surveillance, because we have done both in countries like Britain, America, or Sweden. But of course, surveillance can be used to suppress dissent, it can go too far, and it can be used by a variety of state and non-state entities. So obviously surveillance is not an unalloyed good, but I think we have to acknowledge it has a huge number of upsides as well and can be democratically controlled. So what about COVID-19? So it's critical to say that every functioning state in the world now has a public health strategy to tackle COVID-19, and it emphasizes monitoring residents, so it emphasizes surveillance, and it emphasizes trying to influence their behavior, right? That's just every functioning state in the world has that. This is the essence of public health. And so far, if you were to look across the world, so far, Western approaches promise to be much less successful on the whole than East Asian strategies, right? Obviously, we can have a discussion. There are some countries done a bit better and some countries done a bit worse and so on, but that's the global gist. Now, I'm going to just step back for a second and say why I think that is, right? What has caused the greater East Asian success? I don't actually think it's to do on the whole with greater or more intrusive surveillance. I think this is actually more to do with the fact that they had SARS and MERS and other things before, and so they had built-in capabilities, reserve capabilities that could expand rapidly early on in the course of the disease, and that it gave them political space to take actions that we couldn't have taken in the West, etc., etc. I don't think it's actually to do with the more intrusive East Asian surveillance, but the prominent intrusive surveillance is a feature of East Asian strategies with respect to COVID-19. So if we look at the strategies of 5 East Asian countries, they all rely on quite prominent and intrusive surveillance methods. And this includes democracies, so you see South Korea and Taiwan, partially free territory and state, so Hong Kong and Singapore, and of course the authoritarian PRC. So for limits of time, I can't go into the details, but just to elaborate a couple, the democratic ones there, South Korea and Taiwan. So in South Korea, they were using intrusive tracing, contact tracing via CCTV, credit card data, and so on. And then they were posting identifiable, essentially identifiable data about people that could then be picked up on social media. And they used self-quarantine apps linked to officials. So people will be quarantined in their home and then that will be linked to officials. In Taiwan, they integrated and widely distributed data, for example, about all patients' travel histories, and they distributed that really early on back in February to all hospitals, pharmacies and clinics in Taiwan. So that's something, again, that would be, I think, difficult to do in a lot of Western countries, that kind of dissemination of centralized confidential data. So, and of course we know about China. So a lot of what China did was actually more old-fashioned things like their grid management system, which I can discuss if you're interested in later, and involved a lot of human elements. But they were also able to use rail in order to buy a ticket in a rail company, or to take an aeroplane trip, or to buy a cell phone SIM, you require a government ID. And what this meant is that in China, in the PRC, they could do mass contact tracing with a precision that was much greater than we could do in the West. And there's a variety of other things that they did in China as well. So that's what they did in East Asian countries. But now I'm going to just pull back for a second, talk about COVID, and try and forget COVID happened. Pretend you're back in February 2020, if you're living in London, when we weren't talking about COVID on the whole, and think about global AI competition. Because this is another, I mean, this is all true, right? The mega trend of, industrial change, etc. This is all happening, right, with AI. So very briefly, to reprise this, you have AI's current technical strengths favor surveillance. That's just the nature of it. It's good at Alexa, listening to voices. It's good at facial recognition. This is what all of the key technical advances have been in. China has been applying this in things like the social credit system and so on, which is a huge, complicated system of systems for social monitoring and control. And it's been expanding, exporting that model through things like the digital Silk Road. And essentially, we're engaged in a global competition for influence between digital authoritarian and digital liberal democratic regimes in the global order. Right? And there are a lot of swing states, including to some extent Europe. We're all caught between the behemoths of the Chinese model and the US model. And there are some alternatives like the Russian model and so on, but essentially China and the US dominate in these new AI technologies. And if you're interested, I edited a book with people from Harvard, Stanford, and so on. So what should we do, right? What should we do? Now, I think one critical problem is that in the global competition for influence and to shape the future of AI, the problem is that this is a public health emergency, and unfortunately it showcases the advantages of surveillance, of intrusive surveillance. So it involves necessarily everyone in the world. Now, every functioning state in the world is doing prominent government surveillance, and it's often digital, and it involves preparing powerful surveillance capabilities ahead of time, even for the next challenge. So we face a problem in the West in terms of exerting our influence more broadly and shaping these future technologies. So what model should we have? What model should we have in the West, and how should we be thinking about exporting that, right? And just to say, we mustn't just think about COVID, because actually we're still expecting pandemic flu, right? In 2024 or even 2021, we could have pandemic flu that could potentially kill tens of millions of people, and it will be killing people of working age, for example, right? We're absolutely still in line for another global flu pandemic. So we need to think about how to build democratic surveillance now for COVID, but also to plan for the next pandemic that could be just around the corner. So what should we do? We need democratic surveillance, I would argue, and that really is a two-pronged strategy. What we do within Western democracies. So most of the time you don't need lots of public health capability facilities operating, but you should have a reserve army of Jon Snows. So when you have all the army of the undead with all the thing Game of Thrones there, you have all of these the virus or whatever it is coming towards you, you need to be able to activate your reserve army of Jon Snows. You need to be able to activate your reserve, and that I think is essentially what they were able to do in for example South Korea. It should also be democratically accountable under public health legislation, where that, for example, in Britain. It should be embedded in public health organisations, absolutely not in the police, like they've been doing in using the police in Singapore. It should not be with the military. It should not be with the security service or the Shin Bet in Israel. We should avoid intrusive mass surveillance of individuals, and the tech should aggressively shield individual privacy. And I think there are also really important questions here about digital sovereignty. So that's what we should do within Western democracies, and we should be also exporting democratic surveillance. We should be redoubling our efforts to shape global tech standards, for example, at the UN. We should shape thinking at international agencies like the WHO, and we should also highlight that China is an authoritarian regime, and they helped cause COVID-19 in the first place. But the most important thing we can do to export democratic surveillance is demonstrate success, show that we can do this successfully in the West and have something to sell to the rest of the world. Thank you very much. So as Jonathan kindly said, so we had a paper out recently, and on that I will stop. Over to you, Jonathan.
Thank you very much indeed. Thank you, Nick. There's a lot there, including the concept of democratic surveillance, including the agencies or the government bodies that will be expected to administer such a system. Unsurprisingly, we have a lot of questions. Let me turn to my colleague, Elizabeth Braw, who perhaps a lot of people in the audience do not know. She has a record of tracking undemocratic government or surveillance states going back to the unlamented East Germany of the Cold War and right up to this day. What would you say to this concept of a democratic surveillance that Nick was talking about?
Well, thank you, Jonathan, and thank you, Nick, for your interesting article and presentation. So I think it's deeply dystopian, but going back to the unlimited East Germany, as you said, Jonathan, if I may just make a quick note, it is that the East Germans knew how to do contract tracing long before any COVID-19 pandemic was even in the making, which is obviously more than 30 years ago, actually 30 years ago this year. And if I may just mention an example from the Stasi, which is, as you all know, or was, as you all know, East Germany's secret police. They had, for everybody they were watching, they had a sheet called the WKW, and that stands for Wer kennt wen, so who knows whom. And for each person they had various lines going out, connecting them with whomever that person knew. And so the Stasi knew not just what the person they were watching did, but also with whom they interacted. And so the Stasi was able to make the connections in case people started plotting, for example, forming groups that were undesirable to the government. So if we think that the East Germans were completely useless, actually they did do contract tracing quite well. And that leads us to this conversation, which is, can democratic countries, can liberal democracies do surveillance in the manner that Asian countries, both democratic and authoritarian, have done? And I think what the common denominator in those countries that you have described, Nick, is that they treat citizens not as active participants in their own fate, but as essentially as passive bystanders for whom everything needs to be thought out by the government. And if I can posit as a contrast to that, it's what the Scandinavian countries have done in asking or in involving people in the fight against coronavirus. So they have used different approaches, but what unites them is that they have treated and are treating the population as a resource. So they are asking them, pleading with them to do the right thing. And by the way, the same thing goes for New Zealand, which is another successful example of successful COVID-19 strategy. They are pleading or instructing the public to do the right thing so that the government doesn't have to institute a complete lockdown, as has been the case in many other countries. And I think that strategy has a lot of potential, simply because it's not sustainable for a government to consign people to a passive status, because at some point those people will rebel. That point may not arrive in this pandemic in Asian countries, but what about the next pandemic? Will they be as willing to put up with those pretty draconian measures and that surveillance? And so that leads me to the reserve armies of Jon Snow's that you suggested, Nick. What if we were to make the public willing participants in that venture, so that we wouldn't have to resort to AI and this really quite dystopian notion of surveillance of everybody by the government, but to have a critical number of people involved in tracing themselves and helping others trace themselves. And I'll stop there, and happy to discuss. Over to you, Jonathan.
Excellent, Elizabeth. So the pushback is that this is a dystopian view, which actually was tried even during the Cold War and well before the apps became known, and it actually crushed individuals rather than protecting them. But we could come back to that, and Nick will have a chance of responding, of course. And now to my other colleague, Sidrat, for his own comments.
Thanks very much, Jonathan. So thanks very much, Nick, for a really illuminating talk. I'm sure the audience have a lot of questions for you, and I won't keep them waiting for long. So in my capacity as sort of second discussant, I'd like to do two things. I'll extend very briefly on a couple of points you made and the wider strategic ramifications. And my second function is to act as a sort of advocatus diaboli, raise some of the potential objections to your argument that detractors might make. So first of all, something that sort of struck me when we were when I was listening to your talk and reading your article, was the notion of a sort of spillover effect between security and domestic policy. Usually this spillover effect has kind of gone from security to domestic policy. The state has kind of expanded its capacity in wartime, and people realized that if it could marshal resources effectively towards a security objective, it could do so in a domestic context as well. The rise of the NHS during the post-war period, or Lyndon Johnson's Great Society programs during the Cold War come to mind. I was just wondering, is there a reverse spillover effect that we might see if the sort of surveillance you've talked about comes into place, that if we can justify a sort of a renegotiation of how the state handles non-security issues or non-traditional security issues like disease, does that create a window of opportunity for the security community to have a discussion with society about how other threats, for example, state-centric threats like hybrid warfare, might be handled, how democratic surveillance might be expanded in these contexts to expand the power of the state? So rather than sort of wartime strategy impacting domestic policy within the state, might we see this sort of spillover running the other way? And might that be a potentially useful moment of opportunity for the security community if they can get their messaging right? Having said that, there were a few objections that sort of came to mind with regards to your sort of hypothesis that, though I found it personally compelling, I feel a detractor might make. So I'd be very interested to hear your thoughts on this. So the first sort of set of objections you could sort of group into the "can it be done" sort of category. So, you know, you listed a series of East Asian democracies that have successfully set up models of surveillance. I think one of the issues, though, I had was, does it make sense to group democracies together? Because states that may have similar regime type may have very different political cultures. You know, studies going back to at least the 1950s have suggested that democratic states may vary wildly on, for example, the levels of anti-statism that their general populaces show, the degree to which they're skeptical of state power. And generally speaking, East Asian democracies have been sort of lowest on this parameter. And, you know, that explains, for example, their relatively centralized political economic models, the Chaebol in Korea or the Keiretsu in Japan. So the question is, A, should we be surprised that those states were first to the finish line on the issue of surveillance? But also, are the lessons learned from those states actually transferable to a political context, which is, even though the regime type may be similar, the political culture is sort of radically different. The second question I had was more about sort of contemporary circumstances. So generally speaking, historically, the expansion of state power has rested on two things: sort of cross-partisan bipartisanship, or at least a mutual regard across the aisle between political factions or parties, and faith in the government at the level of society. It would appear that both of those things are fraying right now, and in a way that is more structural than a product of, you know, contemporary circumstance. To give you one example, a study by Peter Trubowitz and Charles Kupchan at Georgetown and the LSE found an almost 20% decline in bipartisan votes in the US Congress between the 1960s and the mid-2000s. So this does really precede sort of present circumstances. Similarly, you know, Peter Schuck at Yale found in the same time period a consistent decline in confidence in the federal government that Americans showed in polling conducted over this 50-year time span. So the question is, even if the expansion of state capacity is desirable, and while this is US-centric, you can find similar results across the West. So even if the expansion of state capacity is desirable, do the political foundations for it exist in the West? And if not, is there a, you might say, a satisfactory alternative? What would satisficing look like in this context if the optimal solution is perhaps not viable? So that's kind of the "can we do it" set of potential objections. The second might relate to whether we ought to. So a detractor might argue that, you know, the laissez-faire model, whether it's in economics or an approach to society, has gone through quite a few crises of confidence over the course of the 20th century. You might think of, you know, the Cold War, where military strategists like Maxwell Taylor or economists like Walter Hellier felt that the very constrained American state in various facets of governance, whether it was economics or its engagement with wider aspects of society, was shortchanging itself in competition vis-a-vis the USSR. Or, take the 1980s, where the strategic trade theorists made the case that, Japan's relatively centralized model of managing its economy with central investment in the industries of the future, microchips, for example, was a superior model to the more laissez-faire, sort of chaotic market-driven model. And yet, both of those challenges, the economic and the geopolitical, kind of fell by the wayside because the downsides of centralization in many ways outweighed its upsides. So a critic might say, is this just, the latest wave in sort of pessimism about the more laissez-faire approach state? And is it, like previous approaches, overweighting the costs and underweighting the benefits of a more laissez-faire approach? In South Korea, for example, their Human Rights Commission has actually come out to talk about some of the issues caused by essentially outing people who might have diseases in terms of the social ostracism they face. What are the long-term political ramifications for citizen trust in the state, for example, of such an approach? And the final question I had was with regards to risk mitigation. So, you rightly raised the sort of the risks of surveillance, whether it's certain excesses post 9/11, the activities of J. Edgar Hoover's FBI come to mind as well. I was wondering, though, for surveillance to be effective, the object of surveillance, you need a certain lack of transparency. The object of surveillance can't understand it so well that he knows how to evade it. And yet at the same time, of course, like you said, the sort of squaring the circle between liberal principles and surveillance requires a certain amount of transparency, certain checks and balances. So in a concrete context, could you perhaps elaborate on what a model for doing this looks like? What the precise sort of, you might say, midway point between those two extremes might look like in practical terms? And yeah, that was my last comment as discussant. Over to you, Jonathan.
Thank you very much, Sid. Nick, would you like to take on the point of, the elaboration on this one and the fact that you may be trying to create an oxymoron in a sense that, as Sid was suggesting, surveillance by almost definition implies a certain sort of procedure of conceit or of retaining a level of secrecy, and therefore the democratic bit is almost as democratic as the Democratic People's Republic of North Korea.
So thank you very much both for excellent points. I mean, I think the first thing to say is that this is not new. It's like, yeah, the Stasi were doing contact tracing well 30 years ago. My grandfather was doing contact tracing well in Croydon in the 1950s. John Snow was doing contact tracing back in the 1850s. This is not a practice that is purely related to authoritarian states. To give you a practical example, and I think this gets also to the question you just posed, Jonathan, is like, say, for example, even in normal times, 3-4 years ago, say, right, in London, if somebody had tuberculosis at RUSI, right, TB, tuberculosis, that is a notifiable disease under public health legislation. And then what they would have done, Public Health England would have come along and they would have interviewed the person, done contact tracing, done a variety of bits, and a circle would have been drawn around that person's contacts. And then all those people would have received notification and they would have been tested, right? And then if they were all clear, and then you expand the circles out and out, right? Surveillance is just something that happens. This is how public health works. Now, and contact tracing works. It's just every functioning state in the world does people who has people who do, lots of people who do that, right? So now we come to the question of how do you strike that balance? And of course, it is extremely difficult to strike. The first thing to say is that I don't think Britain or the US, for example, is going to descend into a dystopian nightmare. I just think it's highly unlikely to happen. But I also think we're going to build new surveillance capabilities related to public health, right? Because, and those will, so for example, what do all our models use now? All our models now are computational models, right? That's how we predict what's going to be happening and where things are going to be spreading and when we might think of reducing the lockdown, etc. It's just because everyone uses computers, right? It's just that's the technology we all use. When you think about contact tracing, right, it is going to involve, or when you even if you're thinking about just looking at society as a whole, right? What government could plausibly get away now with saying we're not going to use any information from smartphones in any way, shape, or form? It just seems quite politically implausible to me that that would be the case. So the question becomes exactly how do we strike that balance? Now, I think we must be extremely careful, as Elizabeth is saying, to make sure that we do not build the sinews of a surveillance state. That's not something I worry so much about in Britain or America. That's something I worry about more in swing states in particular that will be borrowing aspects of these models. Now, how we can do that will involve, a lot of it is going to involve legal and regulatory frameworks, and part of it will be to do with what technologies you can employ.
Excellent. Let's start with the questions, and needless to say, there were plenty of them. I think the first one is from David Byrd, who is asking an interesting question. Perhaps there is a distinction here. Perhaps we are being too purists. Perhaps there's a distinction here between security surveillance, namely collection of data for a state in order to ensure the survival of the regime or the survival of the state, and the collection of health surveillance, namely the collection of data that has only practical application in the context of medical sort of services. So in practice, of course, it means that people will know where I've been, who I've seen, and what I've done. But the information would be collected only for health purposes. So can we create, forgive the pun, a Chinese wall between these kind of data as it is collected? And could that get around the dilemma of efficiency versus liberties? Elizabeth, would you like to start on that?
Thank you, Jonathan. Well, it's technologically possible. The question is whether those entrusted to collect the information would actually abide by that rule and stay on the right side of the Chinese wall. And that's where we as liberal democracies have something that authoritarian countries don't have, which is a free press that can keep a trained eye on whether that's happening and ask probing questions. But once our free press is weakened, we won't have that ultimate guarantee of democratic oversight. Yes, of course, we have free parliaments and parliamentarians who can scrutinize, but journalists are often the first instance of democratic oversight and scrutiny. And if I may make it somewhat related point, it is that our news media are emerging from this or going through this crisis severely weakened because advertising is declining, is plummeting, and we are also used to getting our news for free that many of us can't countenance buying a subscription, and that is extremely dangerous. And then another point, if I may, related to, not exactly an answer to the question, but related to it, it is that even that health information, so while it's obviously a valid strategy and in fact necessary strategy for governments to collect health information to make sure that those who can spread viruses are not out and about, it leads down a very dangerous path, I think. So now Chinese cities have introduced these chip cards where you're either green, yellow, or red, where your access or your movements are based on which category you're in. Well, that gets very close to social Darwinism, where if you're super healthy, you get to do everything you want, and if you're sickly or weak, you cannot. And I'll let you get back to the next question, Jonathan.
Thank you for that, and thank you for a reminder that even if you collect information just for the purposes of health activities, there may be an element there which will end up discriminating against you if you end up being, how should we put it, on the weak side on this one. Let me turn to perhaps the practicalities of this, and we've got a question from Detective Inspector Chris Stewart from SO15, the police, asking about the risk appetite of legislators and politicians to deal with adopting technology. It's time-consuming, it's complicated, it's difficult, and it often is always in arrears. So, Nick, do you acknowledge that this is a problem? Is it the price we have to pay, or is it something that could be done to streamline the way that legally we approve things?
Yeah, well, I mean, we only have to think back to a few months when Matt Hancock, the Health Secretary in the United Kingdom, was being made fun of for his app and the fact he loved technology, and everyone was saying, what an idiot, he loves technology, essentially. And nobody's necessarily saying exactly that now. The other thing to remember is that, so for example, so I'm a clinician, and for a while they were talking about sending me to the Nightingale Hospital, right, this new field hospital they built in the Excel Centre in London. And I was getting ready to do all of that and all this kind of stuff. And it turns out we don't need the Nightingale Hospital as things stand at the moment, because actually the NHS is doing very well. And now people, you can already see that they're starting to pillory the whole Nightingale Hospitals thing as white elephants, what are those idiots doing, spending all that money and blah, blah, blah. Right, whatever you do, you're doomed, right? So I think it's not the technology issue. I think there are two separate things. If you, after the last pandemic, the bits of, I forget now, within the European Commission spent quite a lot of money on things to do with the last flu pandemic that ended up not being used. And they were roundly chastised for that, right? Problem is whenever you plan for something and spend money on something and it doesn't happen, there is a political risk for that, right? You just have to watch Yes Minister to see 100 examples of this. There's a slightly different question, which is about, can we be more agile? Now, I think that we definitely can be more agile. So, for example, in Germany, one of the things they did a bit better than us is they had more of an industrial base that they were of companies, of medical technology companies that they interacted with regularly, and they got those guys involved earlier on, and they utilized those resources to build the things that were needed, right? And we were a bit less good at doing that. And partly that's because Germany has a stronger ecosystem in that, although we have a stronger ecosystem in tech startups and all that kind of stuff than they do in Germany. But I think that's the thing. It's about building understanding and networks between government, academia, business, and building those networks and the ecosystem. And that's how you build in a bit more flexibility and agility. But innovation in the public sector is literally the topic of 1,000 lecture series. So I'm not going to talk much further about that.
I think I'll address the next question to Sid, my colleague, but I mean, do feel free to answer for the others. And it's a sort of a double whammy from Patrick Bond, but also from Vincenzo Camporini. And the question is, we seem to leak a huge amount of information voluntarily or involuntarily to commercial companies, your supermarkets, your airlines with the frequent flyer air miles. Anytime you sign for a so-called free website service, you leak huge quantities of information. We seem to be doing it with abandon. But the moment someone is suggesting doing it to the state, all this kind of debates that we started now happen. And Vincenzo was pointing out in a similar question that actually the only way you can prevent your information from leaking out is by detaching yourself from society at all, by becoming a complete recluse and not attending to any online service whatsoever. So in a way, are we not sort of discussing about an issue that is already well beyond our control? Sid, you start, but others could follow.
Yeah, so I think objectively, that's absolutely correct. We do leak information to, for example, corporations all the time, and you might well argue that many of these institutions are less accountable to their consumer than a state might be to its voter. But I think the more important question is how people perceive things politically. And, you know, as I said, surveys that assess things like the World Values Index, or, you know, sort of surveys of political culture going back to at least the 1950s, do suggest pretty substantial differences of opinion between, let's say, populations of different democracies with regards to whether the state's role in a society is progressive or negative, even when you could make a plausible case that, you know, state intervention has had sort of progressive effects. So I think the question is less about what is objectively true and more about what people perceive to be the case. If substantial chunks of a state's population perceives the state owning their data with more hostility than they do a private sector company, and if, more importantly, the the history we have on surveying suggests that these opinions and these rules are part of a more deep-rooted political culture that you can sort of identify with a certain degree of consistency over about a half century, then the question is less, is it a good idea or not, and more about, is it politically viable or not? It might well be that the East Asian model, for example, is a very efficient one, and that the objections, as you said, to state control of data could just as easily be made about a company. But the question is, once that goes out to the press, to the public square, and to political debate, is that idea likely to find fertile ground in, for example, a Western democracy, and particularly states like the UK or the United States? The evidence we have would suggest that that's at least questionable.
Nick, do you want to come on this one?
Yeah, I mean, I think the questioner was entirely correct. I mean, I like my smartphone. I like my laptop. I like my iPad. You know, there's loads of good stuff. I like flying around, doing things. This is modern life, and people want that. You know, you're not going to tell me that I should go back to, you know, only having a telephone stuck to the wall of my kitchen. It's just, you know, I don't want that fundamentally. And I like being able to read the newspaper on my phone, etc. All of these things, people want all these technologies. It's like, this is a critical thing. Like in Africa, they're not saying, please get me to, you know, 1970s Britain as like the, or America as the apex of you know, the development goal. They're saying whatever's like the best stuff that we have, I want that stuff. Right. And so we are obviously going to have all of these new technologies, and the nature of these new technologies is such they're extremely good at surveillance. So I am now, you know, every time I speak, my telephone can do voice recognition and all this kind of stuff and send it off to Apple or wherever. The problem is we're building the panoply of a huge surveillance state. The question is, right, everywhere in the whole world we're doing that. The question is, how do we get all of the benefits of all these new technologies without, right, which we will want as societies? I think it's impossible that we're not going to want smartphones, etc. How can we get all those benefits without providing the affordances for affording shifts to authoritarianism, shifts so that's used for things like authoritarian control? And that comes down to things like silos. So exactly what the previous question talked about is, how do you separate out health data and tax data and criminal justice data and data about my movements and data about my sexual health clinic appointments? I don't have them, I'm sure. But, you know, all of these things should be siloed data, right? They should not all be open to everyone within government. They should be separated, and there should be rigorous controls preventing the amalgamation of that data. So I think that's how we do. We get all the benefits, hopefully, and we try and minimize the affordances that this technology provides to moving us towards a more authoritarian route.
Well, interesting that you mentioned that. I think we all agree on the silos, and I think Elizabeth also mentioned the, you know, how do you prevent this data from being cross-referenced and used when it is so easy to do so. So we have a question from Mata Silva from Porto University in Portugal, who's asking, well, now that we have the example of Dominic Cummings, the Prime Minister's advisor, attending meetings of committees that are meant to look only at the scientific evidence, what kind of effective safeguards we would have that data that is collected for medical purposes doesn't end up seeping into political decisions and being used all over the shop. The same applies to a question from Vytautas Rudavicius, who is working, I think the name is Lithuanian, but is working for Spanish TV, asking the same question about the safeguards. Indeed, we were swamped with questions about safeguards, as you can imagine. So, Nick, how collecting the data can be kept in a sort of lab vials separately and uncontactable one from the other? I think you're on mute.
Oh, sorry, I unmuted myself and then I think the moderator remuted me accidentally. So do the counterfactual, right, and say, right, if you pick up a book about digital transformation, which you probably won't do because it's quite boring, but if you pick up a book about digital transformation in an organization, right, a company or whatever, one of the first things they say is you need to unify across all your different databases, right? You need a unified stack is a prerequisite to digital transformation. That's the kind of thing you'll read, all right? And it's really, really hard to do, right? I worked in the NHS for many years, and we had loads of computer systems, none of which could talk to each other. Right? Everyone who's done anything in a big organization knows you have all these legacy systems that don't talk to each other. So I think one thing is we should actually try not to break down silos, right? And I know you said everyone agrees with that. It's not true that everyone agrees with that. The World Bank, lots of development people, they're all about breaking down silos, right? Having unified data. Google, all of these other people, they all want everyone to break down silos, break down data. Palantir, all of these people, right? It's not true that everyone agrees that silos are a good thing. In fact, so I have a report coming out with the National Endowment for Democracy in Washington about in which this is a key point. Even I remember Googling advantages of silos recently, right? And all you got showed were all the disadvantages of silos, right? So no one talks about, like, a lot of people barely talk about how important silos are. And I think one of the things is just try, and when you're building new computer systems, try not to build silos where you don't, try not to integrate where you don't need to. But in addition to that, it will come down to regulatory frameworks. And here a public health thing is really important. In World War I, right, why did we introduce in Britain private sexual health records? The reason is many more soldiers were getting STDs, right, sexually transmitted diseases that were meaning they couldn't operate in the trenches, than were getting trench foot, right? STDs are a much bigger problem, but people don't like to report STDs. So as a consequence of that, they introduced rigorous privacy for sexual health clinics. And we still have that. When I used to do HIV clinics and stuff, that HIV, sexual health things are quite separate. Rigorous ways of protecting certain types of information is entirely possible. It is done right now in countries like Britain and the United States, and it can happen in the future. We've done it before, we can do it again.
Thank you for that, Elizabeth.
I just have a quick point about silos. So the case that both of those questions refer to is what happened here in the UK when Dominic Cummings attended meetings of SAGE, which is a group whose membership isn't communicated to the public, and there are no minutes from their meetings. So it's all shrouded in mystery. And Dominic Cummings attending those events then became an even more mysterious thing. And I think the only answer to that is more transparency. I don't think there's any reason that meetings of SAGE should be, that the membership should be secret, because that will only enhance conspiracy theories about why Dominic Cummings or whoever might attend, and what their purpose is. So silos or no silos, I think the only way to better bring in the public into the conversation is more transparency, because with national crises like this, we are all affected, and we all desperately want answers. Then when it comes to different parts of society working too little together or too much together, I think technological silos are probably more a hindrance than the other way around. But the only answer, I think, to all of these issues is full transparency, and then rumors won't flourish.
I think the next question I'd like to ask is quite an interesting one, is to Sid, my colleague, because it resonates with the point that you mentioned, that a lot of these things about privacy and the sort of conflict of privacy actually are related to the sort of national context of individual countries, the collective psyche, as it were, and perhaps the historic baggage of certain countries. As Elizabeth would know, the Germans are much more sensitive to anyone collecting information than many other Europeans. But there's a question from Michael Lithgow, who is asking whether it's true that perhaps smaller states, Taiwan, Singapore, may actually be better at creating the consensus about what technology should be brought to bear in an emergency than bigger countries. So there may be a question of size involved in it as well, and a sense of community spirit in a more cohesive way that may facilitate these activities.
Yeah, I think the question of size is certainly a factor, and on the community spirit point, certainly, for example, value orientation towards individualism and collectivism in a society is something that has been measured for some time through things like the analysis of respondents' answers to questionnaires and factor analysis. And generally speaking, that's sort of the emphasis on perhaps a more collective, cohesive sort of social ethos, where it's found more prominently, could be a perfectly reasonable explanatory variable for why these societies are able to pick up and to establish a consensus on the use of technology. The question though then becomes one of what does satisficing look like in a political context where that's not viable. On the size question, I mean, it is possible that size is a factor, although it's worth considering that, some fairly large countries, South Korea, for example, and Japan have also been fairly quick to adopt. So I'd probably weight the sort of, as you said, the collective consciousness as a variable as being more important than geographical size or population size. But certainly I'd say that is a factor worth considering. And then the question of, the fungibility of these lessons comes to mind.
Excellent. I now would like to move to a question that I always find the killer question in all these discussions, which is that a lot of this stuff is a very internal British discussion because of the absence of identity cards in the UK. So if we had an identity card with a unique number and a unique identifier, we would have had a bit of information that the state would have been able to harvest anyway, with all the safeguards that we can talk about. So Leanne Cockram is asking whether this epidemic is not actually a good argument for the introduction of identity cards. Nick?
So I would say the first thing is has there ever been a crisis or emergency that hasn't been a good opportunity for advocating identity cards be adopted? So basically no is a simple answer. So they have been useful, or they have been used rather in what seems like important ways. So to give you an example, Taiwan. So in Taiwan, they integrated early on, back in January, February, they integrated the identity card database and the health database, because they have a centralized health system, and with other types of data, and then they were able to push data out and so on. So now it does have some utility, right? But if you were to say what fundamentally would be much different in the British response if we had identity cards, or for example, if you compare Britain and France, France has done no better in this than Britain in any meaningful sense, right? So I mean, yes, you can always make an argument for identity cards. Should we introduce identity cards? No, we're not actually at war, And again, to go back to Yes Minister, in one episode when they're trying to get identity cards introduced, we didn't fight 2 world wars to introduce identity cards. And I think hopefully that will be the more classic British response.
But you do accept that a lot of perfectly good functioning democracies in Europe operate on the basis of quite a lot of data being collected through identity cards, and people don't consider that a particular burden. So it may go down to Sid's argument that some of this, at least, is up to the question of the setting and the historic background.
May I just make one other comment? So I think this, and again, I do think there is a lot of that, to be honest with you. I think there's a lot about political culture. And so, for example, I went back and I was looking at the introduction of police forces. So in England, in Britain, we didn't have police forces. They started introducing them in the 19th century, late 18th, early 19th century in Scotland. Then in London, they introduced, Sir Robert Peel introduced the police force in London, the Metropolitan Police, that basically became the template for global police forces. And what they were really worried about was, if you introduce a police force, this is going to end up being a secret police like they have in continental Europe, or as was employed, for example, in Ireland. And they didn't want that, right? And so the critical thing was they introduced the Metropolitan Police, and you can read Hansard on this, and so the argument was it had to be consistent with the character of a free country. You can do these things. I think we benefit from having a police force in London, but you can do it in ways that are more or less consistent with the character of a free country. And that's what we need to do with these public health measures moving forwards.
Excellent. I think that this is perhaps a good moment to conclude. I didn't expect that we're going to get a consensus, and we didn't get a consensus. What I think we did get is a push and pull argument, looking at both sides. It's incontrovertibly the case that in pandemic situations, states or health services need a great deal of data. It's incontrovertibly the case also that the data could be abused and misused. And a lot of, in fact, questions, sadly, we couldn't answer, were pointing out precisely to the number of times that this data was either negligently leaked or purposely leaked for baleful intentions. So in that respect, it's not straightforward one or the other binary argument. It is also always a question of the final compromises. So all we could bring in this discussion is just the tensions that exist there. Thank you, Dr. Wright, for your presentation. Thanks, my colleagues, Sid and Elizabeth, for taking part. And above all, thank you, the audience, for asking so many questions. Sadly, we only managed to answer a few of them. Let us see each other again in a week's time, when we will be looking at British policy towards China as an outcome of the pandemic, a subject which may yet again bring the subject of information as well. Thank you all for joining us.